Hi, I'm Ira from Lavender Medicare. Thank you for joining us today. And today we're going to talk about stroke. Stroke can be dangerous and it can happen to anyone. It's important for us to know what we can do and how to get the best treatment possible. What symptoms do we need to look out for and what causes stroke?
Something has happened to the blood vessels of the brain. Now, stroke has got two types. The blood vessel, when it's blocked, that is an ischemic stroke. Roughly 80% of the strokes are ischemic strokes, or the blood vessel ruptures and causes bleeding inside the brain. That's called a hemorrhagic stroke. How do we recognize a stroke? Whenever you see anyone with weakness, sudden onset of weakness, sudden onset of numbness, a sudden drooling of the face, sudden difficulty with speech, or weakness of the hands and legs of one side of the body, that is a stroke. And the most important component at this present moment is to bring the patient to the hospital. You need to go to the hospital as soon as possible. Please do not sit there and ponder, is this a stroke? Am I overreacting? No. Whenever you see weakness, numbness, speech difficulty, hands and the arm and leg is not moving well, saliva drooling, go to the hospital immediately. Now, why? Why do we do so? Because time factor is important. When the onset of symptoms, the clock starts ticking. We need to be in the hospital within 4.5 hours. Because if the patient reach the hospital within 4.5 hours and we do the scan, we can immediately give a medication to dissolve that blood clot. And when we give the medicine to dissolve the blood clot, the patient have a chance of near or total full recovery. Now in the hospital, after we give the medication, now within 1.5 hours, if the speech doesn't recover or weakness don't recover, we will go even further. We will bring the patient down to the radiology department, put a catheter up the blood vessel and go to where the clot is and suck out the blood clot. All this can only happen if the patient reaches the hospital within 4.5 hours. Beyond the 4.5 hours, that becomes an established stroke. We can't do this maneuver because if we give the medicine after 6 hours, there's higher chance of bleeding. So the protocol is that hospitalization must reach that state within 4.5 hours.
So what happens if the patient is too late, they didn't come on time?
What we do is that we look at the scan. Now, if the area of stroke is small, generally nothing much happens. But you must also remember, when a cell dies due to lack of oxygen in the brain, it will swell up before it disintegrates and melts away. So if the area of stroke is a large area and the brain swells up, then the pressure inside the head will go up. So in order to save the patient's life, we will then have to remove the skull bone to relieve the pressure to save the patient's life.
Does ischemic and hemorrhagic stroke present in different ways?
No, they both present in the same way. They both present with weakness, numbness, speech difficulty, facial palsy, and also limb weakness. They present in the same way.
Is there anything that we can do to prevent stroke?
Yes. Now, ischemic strokes are, of course, due to narrowing of the blood vessel. All these are associated with high cholesterol or associated with problems with diabetes, problems with smoking. So at this point in time, I must make it clear, the factors affecting ischemic stroke are the same factors affecting the heart. All the risk factors are the same. Therefore, it is important to control the blood pressure. It is important to control the cholesterol. It is important to control the diabetes. Hemorrhagic strokes, of course, again, you must control blood pressure. Sometimes hemorrhagic strokes are due to aneurysms inside the head. Aneurysms are small outpouching of blood vessels inside the head, and it is found in about 3 to 5% of the general population.
If we manage to save the patient from the first stroke from aneurysm, can it happen again in another blood vessel?
Generally not. It's a blood vessel, then there's the aneurysm. Once we put a clip and secure it, generally it doesn't really happen again. On the other hand, if the blood vessel and there's aneurysm, we put a metal coil inside there. Coiling is associated with a greater recurrence. So basically, after 3 years to 5 years, you will need to repeat the angiogram to make sure that the aneurysm has not grown further. There are certain conditions that more predisposes to a formation of aneurysm. There's this condition called polycystic kidney disease. It will pass down the family line. So for these patients with a polycystic kidney, they tend to form aneurysms inside the head. Once we do a scan of the head, we have excluded whatever structural abnormality. Then after we can then focus on high blood pressure control, smoking, diabetes, lipid profile, and lifestyle modifications.
It's something that is within our control actually.
Yes, it's absolutely within our control. You screen, you can prevent strokes by up to 50 to 60%.
Thank you so much for the information, Dr. Chou Ning. It's very important for us to know and recognize the symptoms and quickly go to the hospital, and even we are able to prevent the stroke from happening by changing our lifestyle.
Thank you very much.